Hello everyone, and welcome to our webinar, Falls and Brain Injuries Among Older Adults, Part 2, Partnerships, Programs, and Public Policies, hosted by the National Association of State Head Injury Administrators in collaboration with the National Council on Aging. I'm Carrie Bennett, Chair of NASHIA's Training and Education Committee. Our webinar organizer is Haley Cushion with NASHIA. If you have any questions or issues, please contact Haley at training@nashia.org. Thank you so much for joining us. The National Association of State Head Injury Administrators is a nonprofit organization, and our mission is to assist state government with promoting partnerships and building systems to meet the needs of individuals with brain injury and their families. NASHIA was founded in 1989, and it's a one-of-a-kind organization representing state employees working to support individuals with brain injury and their families. Our membership includes employees in various state agencies such as public health, education and aging, advocacy organizations, service providers, and individuals and families with lived experience. NASHIA advocates through legislation, providing technical assistance directly to states and through federal programs, and offers quality training at NASHIA's annual conference and through webinars such as this one. Many of our webinars are free and available for viewing at nashia.org. Archived trainings are available on a variety of topics related to brain injury. Some webinars offer a certificate of participation, including today's webinar, which is available for a nominal fee, $10 for members and $15 for non-members. To purchase a certificate, please visit nashia.org and click the Education and Training tab. If time allows, today's presenters will answer any questions you might have. Please post your questions in the questions pane of your attendee control panel. If we run out of time, the presenters will respond to your question directly through an email. Handouts as well as a printable version of today's presentation are available for download. Please check your attendee control panel for the handouts pane. Our objectives today are to explore community-based programs and prevention initiatives, to identify state and community partnerships, and to highlight public policy related to adults with traumatic brain injury. And I'm very pleased now to introduce our presenters. Chelsea Gilchrist is a social gerontologist with experience in scaling community-based health promotion programs, conducting research analysis, and implementing national education and awareness campaigns. In her role as a senior program manager at NCOA, she supports the dissemination of evidence-based health promotion programs, develops professional and consumer resources, and identifies opportunities for new partnerships. Ms. Gilchrist holds a Master of Gerontological Studies degree from Miami University Scripps Gerontology Center. Dr. Thomas Egan is a Health and Aging Policy postdoctoral fellow at the University of Washington, where he is focusing on services for adults aging with physical disabilities. He received his PhD in Rehabilitation Science and MPH in Health Systems and Policy from the University of Washington. He serves as a research consultant with the National Council on Aging. Liz Harnois, a certified brain injury specialist, is the Community Outreach Manager at the Brain Injury Association of Massachusetts. During her first years with the organization, her role was funded by an ACL grant to create linkages between the brain injury community and aging services in Massachusetts, accomplished through outreach and training efforts. After the grant's end in June 2018, she was promoted to Community Outreach Manager, and she now oversees the strategic statewide outreach initiative for the agency. In this role, Liz makes new connections across Massachusetts with the goal of educating the public and healthcare organizations about brain injury and the services that exist in the state. Maggie Ferguson is the Brain Injury and Disability Program Manager at the Iowa Department of Public Health, and she has served in this role since 2013. She's spent approximately 20 years in various capacities advocating for and supporting individuals with disabilities and their families. Currently, this includes directing initiatives to improve concussion management among youth in Iowa, to improve the health of Iowans with disabilities through increased physical activity, better nutrition, and reducing obesity, and to increase the use of evidence-based fall prevention programs. Maggie received her Master of Science degree in counseling from Drake University in Des Moines. She's currently certified as a rehabilitation counselor and brain injury specialist. And finally, Susan Vaughn is the Director of Public Policy for the NASHIA, and she's the founder and was the association's first president. In this capacity, she monitors federal legislation, rules, and regulations, provides input on proposed legislation, drafts testimony, letters, and support materials, and produces public policy newsletters. She represents NASHIA on injury prevention, disability, and research coalitions. She also provides technical assistance and consultation to states with regard to service delivery. Susan has an extensive background working in state government, brain injury organizations, and federal programs to advance the field of brain injury. She received a Master of Arts in Education, majoring in Special Education from Southeast Missouri State University, Cape Girardeau, Missouri. And now I'm very pleased to turn over the presentation to Chelsea Gilchrist.
Thank you so much, Carrie. I appreciate the action. A little background about our partnership between NASHIA and the National Council on Aging. We partnered to develop a two-part webinar series to increase education and awareness about strategies and resources to prevent falls and brain injuries among older adults. Our first webinar on the connection, prevention, and resources related to falls prevention and brain injury. We discussed risk factors around these two topics, screening and assessment tools, and resources for professionals and consumers. And this webinar is archived, so it's available for you to view the webinar recording as well as the presentation slides through the link here on this slide. Our webinar today, we're really looking forward to discussing community-based partnerships and education initiatives, state and community partnerships, and public policy initiatives. First, to provide a little bit of background about the National Council on Aging, we are the national voice for every American's right to age well, and our vision is a just and caring society in which each of us, as we age, lives with dignity, purpose, and security. We accomplish our mission by identifying challenges facing older adults, creating solutions through collaborative leadership, innovative services, and advocacy, and then bringing these solutions to scale to improve the lives of millions of older adults. Within the National Council on Aging Center for Healthy Aging, our goal is to increase the quality and years of healthy life for older adults and adults with disabilities. We oversee 2 national resource centers funded by the U.S. Administration for Community Living. The first is the Chronic Disease Self-Management Education Resource Center, and the second is the Falls Prevention Resource Center. We also provide resources and education related to other key health areas, including behavioral health, physical activity, immunizations, and oral health. The National Falls Prevention Resource Center, our goal is to increase public awareness about falls prevention and strategies, to serve as the national clearinghouse for tools and resources, and to support and stimulate evidence-based programs and strategies. I wanted to provide a little bit of context and background about the prevalence and impact of falls and brain injuries among older adults. They are both common and costly. For falls in particular, 1 in 4 Americans aged 65 and older falls each year. Every 11 seconds, an older adult is treated in the emergency room for a fall, and every 19 minutes, an older adult dies from a fall. In 2015, the total cost of fall injuries was $50 billion, 75% of which was paid for by Medicare and Medicaid. For brain injuries in particular, we know that falls are the leading cause of traumatic brain injuries among older adults, and that the rate of mortality due to TBI is increasing among older adults that are at the age of 75 and older. In 2003, the aggregated cost for treating traumatic brain injury in older adults exceeded $2.2 billion. We also know that falls and brain injuries significantly impact quality of life among older adults. Falls in particular can lead to serious injuries, such as brain injuries, hip and spinal fractures, and broken bones. It can also lead to an increased fear of falling and restriction of activities, which can in turn lead to social isolation, depression, and feelings of helplessness. Falls can result in a loss of independence and mobility, and we know that falling once doubles an older adult's chance of falling again. For brain injuries in particular, they can lead to worse or new cognitive impairment, vestibular dysfunction and gait instability or vertigo, fatigue, depression or behavioral changes, sleep difficulties, hearing or vision changes, and migraines and headaches. The good news we're here to share in today's webinar is that many falls and brain injuries can be prevented by addressing known risk factors. And an overview of those risk factors was presented in our first webinar. But today we really want to address strategies, partnerships, and programs through the implementation of evidence-based falls prevention programs that have been proven to help older adults and adults with disabilities reduce their risk of falling and/or their fear of falling. These programs are available for older adults with a low, moderate, or high risk for a fall. And the content of these programs includes one or more of the following: cognitive restructuring, balance, strength, and gait training exercises, group discussion, practical solutions, home safety modifications, and educational presentations from experts in the community, such as physical therapists or occupational therapists. And now I'd like to turn the presentation over to Thomas Egan, a research consultant at the National Council on Aging, to discuss the impact of programs on participants with traumatic. Thomas?
Thanks, Chelsea. So I'm so excited to be a part of this partnership and on this webinar today to kind of present some of the research findings that have come out of the literature in the last couple of years, looking at fall prevention programs with individuals with traumatic brain injury. The first article, so I looked at three different research articles. The first one looked at older adult participants with the TBI who attended a program called Tai Chi Qigong. And it's an exercise program that also incorporates a meditation component. And what the researchers found is over the 8 weeks that the participants engaged in the exercises, there was a significant improvement in mood and self-esteem in that exercise group when compared to those who did not perform those exercises. The second article that I looked at was a different Tai Chi program that also incorporates exercises, slow mindful movements, and they explored the effect of Tai Chi again compared to a control group. So the control group was not performing the exercises over the 6 weeks. And this, what they found is a significant reduction in confusion, anger, tension, and fear, and an overall improvement in energy and happiness. And I'd like to point out that in this program, they actually adapted the program specifically to meet the needs of the TBI patients. So the classes were shorter and they were more frequent. Initially, the program was going to be offered once a week over the 6 weeks, and they opted to do twice a week to really kind of hone in on the exercises and address the short-term memory. The last article was really exciting, looking at veterans coming back, returning from combat with a mild traumatic brain injury. And they were a younger population than what we've seen previously. So they were 21 to 48. And they performed a similar program as the first article, the Tai Chi Qigong. And what they found is that these individuals really had reduced anxiety and increased ability to regain their control of their lives just in general and control of their emotions. And I'd love to read just one quote from the interviews that they had where a participant said, quote, "I would wake up periodically in the middle of the night just because I was antsy. Sometimes I'd lay there for 1 or 2 hours. My brain would always be racing thoughts, and it was like I just couldn't go to sleep. Now I do this Qigong routine once before I go to bed, and I got a clear mind. I'm just relaxed, and it takes 5 minutes to fall asleep, and I'll sleep throughout the whole night." Okay. So just in general, kind of high level results of what we've seen is the effect of these programs on participants with traumatic brain injury is that programs with methodical, slow, and structured movements that also incorporate a mindfulness component demonstrate effectiveness in reducing the negative effects that occur following a traumatic brain injury. Participants with a traumatic brain injury also benefited from the social component of the fall prevention programs that they participated in. And then, really excitingly, is that the programs like Tai Chi have the potential benefit to reach a younger population with traumatic brain injury. And now I'll pass it back to Chelsea, who will talk a little bit more about the evidence-based fall prevention programs that are currently available.
Thank you, Thomas. So this slide here lists all of the evidence-based falls prevention programs that have been proven to help older adults and adults with disabilities reduce their fall risk and or their fear of falling. I'll be discussing several of the programs listed here on the slide, including the 3 Tai Chi programs. But for more information about the training, costs, and outcomes of each of these programs, we encourage you to visit the link here on this slide. And these slides will be available after today's presentation. There are 3 different evidence-based fall prevention Tai Chi programs. Across the programs, the components of these programs improve strength, balance, flexibility, and mobility through slow and therapeutic movements of Tai Chi. The program outcomes include decreased fall risk and stress and improved, as Thomas mentioned. And the programs range from 8 to 48 weeks with 1 or 2 classes held per week. Tai Chi programs typically do not include any educational component. The 3 different programs, Tai Chi for arthritis, Tai Chi Quan, moving for better balance, and YMCA, moving for better balance, are best suited for adults who have a low fall risk and have not had a fall in the past year. The Tai Chi movements can be adapted to accommodate adults with mobility challenges. In particular, in the Tai Chi for Arthritis program, movements can be modified to accommodate mobility issues and can be done seated as a starting exercise. In the Tai Chi Quan and the YMCA Tai Chi programs, they are able to accommodate people with a mild level of mobility difficulty, such as people who are occasional cane users. For this next program, Enhanced Fitness, I'm actually going to turn our presentation over to Thomas, who is a trainer in this program and has held several workshops himself.
Thanks, Chelsea. Enhanced Fitness is an ongoing class that's composed of 1-hour classes that are held 3 times a week. This is a great class for individuals with traumatic brain injury based on its structured component. Each class is essentially the same and starts with an aerobic component to get the heart rate up. It incorporates balance training and walking activities, and it always ends with a strength component that has the same moves from one exercise to the next and is always modifiable, and it ends with stretching. What's great is that this class can be done standing, those who are concerned about their balance are able to participate with a chair in front of them to increase their stability and confidence. And it's all conducted in the same class. I've actually taught classes where a couple of the individuals were in wheelchairs and they were able to participate in the same class next to people who were standing and doing all of the exercises while standing. And now I'll pass it back to Chelsea to talk about the other programs.
Thanks, Thomas. Another program, A Matter of Balance, is an 8-week structured group intervention that emphasizes practical strategies to reduce fear of falling and increase activity levels. The program components include a peer group discussion, exercise, education about steps older adults can take to reduce falls, such as making simple home modifications, and behavior modification. In this program, participants learn to view falls and fear of falling as controllable. They set realistic goals to increase their activity. They change their environment to reduce fall risk factors, and they exercise to increase strength and balance. This particular program is intended for adults with a moderate risk for a fall. All the exercises in the program can be done sitting or supported standing, and therefore participation does not require the same level of mobility as some of the other programs intended for adults with a low fall risk. Stepping On is a program that is implemented through 2-hour weekly classes over the course of 7 weeks. The class content includes peer discussion, exercise, and weekly expert lectures to educate participants about fall prevention strategies. The guest experts can include occupational therapists, such as the one in this photo demonstrating how to safely get up from a fall, optometrists, physical therapists, and many more. This program is intended for older adults with a low to moderate risk for a fall who can stand unassisted and walk independently before beginning the program. And lastly, the last program I'll review in our discussion today is the Otago Exercise Program. Otago includes a series of 17 strength and balance exercises delivered by a physical therapist or a physical therapy assistant in the home, outpatient, or community setting. It is intended for frail older adults with a high fall risk, and it's an exercise and walking program tailored to the participants' needs. So to find a falls prevention community partner and program near you, we recommend that you check out NCOA's Evidence-Based Falls Prevention Programs webpage, the first link here on this slide, to learn more about these programs and to connect with the programs directly. To find a falls prevention partner or a program in your community in particular, you can connect with the State Falls Prevention Coalition or an Administration for Community Living Evidence-Based Falls Prevention Program grantee. And I'll talk more about those two particular resources in the next slides. There are over 43 state falls prevention coalitions across the U.S., and they all have the common goal of reducing older adult falls, fall-related injuries, and deaths in their communities and states. Every coalition is a little bit different, and members are typically interdisciplinary and include professionals in public health, aging services providers, hospitals, prevention, and many others. Coalitions are knowledgeable about falls prevention efforts and events and programs in their communities and can connect professionals and older adults with efforts that are particular to their fall prevention and brain injury prevention needs. So to contact a State Falls Prevention Coalition, we recommend that you reach out to the coalition leads that were linked in the last slide. You're also welcome to connect with U.S. Administration for Community Living Evidence-Based Falls Prevention Program grantees. Since 2014, the U.S. Administration for Community Living, or ACL, has awarded 39 grants to state and tribal grantees to implement and disseminate evidence-based falls prevention programs and strategies across the nation over the course of a 2 to 3 year grant. These grants have been awarded to public and private nonprofit entities, state agencies, community-based organizations, universities, and tribal organizations. We welcome you to view the grantee profiles linked here on this slide to learn more about the efforts in your state, including program leader trainings that are available and sites that you can refer participants to engage in evidence-based falls prevention programs. Thank you so much for listening in to our presentation today. And without further ado, I'd like to pass our presentation to Liz Harnois to share how her state has built community partnerships to increase awareness about falls and brain injury prevention strategies and evidence-based falls prevention programs.
Thank you very much. I'm Liz. I'm from Massachusetts. For those who may not be familiar with a brain injury association in your particular state, I'll just say a word about our organization and the mission of our organization. The Brain Injury Association of Massachusetts is a private, nonprofit organization that creates a better future for those who are affected by brain injury. And we do that by educating the public on the risk and impact of brain injury, promoting programs to prevent those injuries, advocating for improved legislation, and offering support and resources to people with brain injuries and also their family members and caregivers. I'm going to give a little bit of backdrop in regards to our statewide collaborations, which all began with our ACL grant. Our ability to provide education on brain injury and form the aging community was funded in part by the grant, which was awarded to Massachusetts and managed by the Massachusetts Rehabilitation Commission. The partnership between the Mass Rehab Commission, the Brain Injury Association, and the Executive Office of Elder Affairs and their network of aging and disability resource consortia created new relationships within our communities who are invested in a message of prevention. As a Brain Injury Association of America affiliate, part of our mission is to prevent brain injuries from happening. So it made sense for us to include that message within our education that was provided to the aging community as part of this grant. And I will say too, if people are looking, I'm not sure if other presenters might have this as part of their slides as well, but if people from other areas of the country are looking for a Brain Injury Association affiliate, you can visit biausa.org and find an organization in your community. So part of the presentation that we developed as part of the grant, which was to help to educate the aging community about brain injury and to create those linkages, again, included information on acquired brain injury, a pretty broad overview, but some thorough information. And we emphasized traumatic brain injury specifically in the older adult population. And a big part of that included connecting falls as the leading cause of traumatic brain injury in all age groups, but specifically identifying the rates are the highest in those who are over 60 years old in the state of Massachusetts. Part of the presentation, which was particularly important to educate the aging community on the importance of screening for brain injury. The folks that we were training in our formal clinical trainings, but also through awareness presentations, were people who were not necessarily going to be doing any sort of diagnosis. And so utilizing something that was certainly not a diagnostic tool, screening tool, and we used the HELPS tool, which we're happy to share links to where people can find that that particular screening tool for brain injury. We really encouraged people to identify individuals who may have a brain injury and sort of ask the question, could it be brain injury? As we know, in the aging community, there's often a lot of reasons why cognitive decline or cognitive changes could emerge or occur, for example. And so again, asking that question, could it be brain injury? And then encouraging two-way referrals back and forth between the brain injury services in Massachusetts and the aging and disability services that exist in Massachusetts. And that was really to support this idea of a no wrong door model, where we were hoping that people who, whether they be over 60, under 60, with a brain injury, if they approached an organization for services and supports, they were going to find what they needed in terms of their either their brain injury or their experience as an aging individual. Another part of the presentation, which was tailored for specific groups of people, and I'll talk a little bit about some of those specific groups in the next couple of slides, was to really incorporate ways that older adults can prevent falls as the leading cause of brain injury. And of course, the previous presenters talked about all this wonderful programming, many of which we share in the state of Massachusetts within different systems and organizations. What we were using in our presentations was the messaging from the CDC's STEADY toolkit, and sort of highlighting these four main ideas that speaking to your healthcare professional about, or provider about your risk of falls, exercising, which includes balance and strength, improving balance and strength, having an annual eye examination, improving safety to your home environment, or some things that individuals can do to reduce their risk of falls. Again, sort of supporting this idea of a message of prevention, which goes, which is definitely important to our organization. In terms of the Falls Prevention Network in Massachusetts, there's a very strong network of providers and organizations that also have the message of falls prevention is first and foremost in their work and in their mission. And so one of the ways that we all come together is through the Falls Prevention Coalition in Massachusetts. And the Brain Injury Association has been a natural partner and collaborator as part of this coalition for at least 10 years, a little bit over 10 years. I'm trying to look back actually and see where staff have come and gone as part of that coalition. And this network of organizations and providers has many different ways that they are already spreading the message of prevention in terms of whether it be programs like we were talking about before, Tai Chi, Matter of Balance, and then some individual organizations that have really created their own specific falls prevention programming. And some were already incorporating screening for brain injury, which I thought was particularly interesting. One in Massachusetts is called the Latino Health Insurance Program, and they were incorporating Spanish and Portuguese falls prevention courses that incorporated people that had already fallen, already experienced head injuries, and then were at increased risk of future falls. So that's just one example of something that a member of the coalition has been doing. Something else that I wanted to mention in terms of the collaboration with the Falls Prevention Coalition was really our ability to make new partnerships within the state to help each other spread awareness of both brain injury and the importance of preventing falls. Some of those collaborations included the Massachusetts Association for Assisted Living facilities, and that is an entity that oversees assisted living facilities in Massachusetts. And we're able to do a few different things with that group in terms of presenting at a nurses conference and collaborating with individual facilities. And so I think some of those partnerships became really important during the work of the grant, for sure. And a lot of it, too, is not having to reinvent the wheel. There's plenty of organizations that were already spreading the message of prevention and talking about falls, but having the brain injury community involved in these conversations and adding the importance of screening for brain injury, identifying brain injuries, and then also making sure that people understood where the resources and supports were able to be accessed in terms of our state agency, the Massachusetts Rehabilitation Commission, the services that are offered on the state level, and also the community-based resources as well. Some other things that we sort of learned along the way in terms of being part of the coalition was all the different work that the individual hospitals in Massachusetts have been doing. Mass General Hospital and St. Vincent's are in Worcester. Mass General is in Boston. St. Vincent's is in Worcester, Mass. Those two hospitals are examples of hospitals that have created their own falls prevention efforts. And I wanted to mention St. Vincent's because I think that was something sort of special that I hadn't necessarily heard about before. They have a walk with a physician where individuals can go to the hospital, especially when the streets might be icy or something like that. They can actually walk the long hallways of the hospital with physicians during the lunch hour to improve strength and balance. So I thought that was something interesting. One of the other key things that sort of propelled us into the conversation of falls prevention and the coalition in Massachusetts was to be able to take a bigger role in helping to plan for the statewide Falls Prevention Awareness Day, which happens every year at the Massachusetts State House. And this past year, I had the pleasure and an honor really to work with the individuals that have been planning this for the last several years. And the Brain Injury Association just sort of took a larger role in that. And I think by doing that, again, we were able to connect the brain injury community and the aging services community and specifically talk about brain injury when we were having the conversations about falls. Something that I wanted to sort of call out and pay attention to specifically was our relationship with the councils on aging, specifically in Massachusetts. The councils on aging, their networks are already very closely incorporated with our Executive Office of Elder Affairs, and through those partnerships that were strengthened, either created or strengthened through the ACL grant, the community of councils on aging had really welcomed us to share the information that we had about falls and brain injury in many different levels. And so when we are looking at a group that is fairly large, we've got, I think over I wish I knew this off the top of my head, geez, I feel silly now, but over 350 towns or so in Massachusetts. And so there's certainly a lot of individual councils on aging, but they're all connected as part of the Massachusetts Association of Councils on Aging, or many are included in that group. And so we sort of looked to educate from the top and more broadly down, and then also on the ground back up to the top. And what I mean by that is having presence at the national, the annual conference for MCOA was important in terms of exhibiting, sharing information, having a workshop presentation, one of the years of the grant at that conference, but then also doing some work to educate the directors and outreach workers within their smaller partnerships across the state. So there's groupings of between 10 and 20 individuals that get together and talk about their region of the state, and we were able to target several of those groups, even outside the area of the catchment area for the grant, and educate the directors and outreach workers about what we were doing and the services that existed for brain injury in Massachusetts. And then those directors and outreach workers helped us to share that information with their communities. So sort of the next step that came to be was our ability to provide information to the older adults within each individual community. There were many councils on aging that, after seeing the information that we were offering about brain injury, falls prevention, services that exist in Massachusetts, they were interested in bringing that message to the older adults in again, the individual community. And we did that through lunch and learns. We did that through health fairs in the towns, and we did that through other presentation settings that that took place either at the town hall or somewhere centrally located at the Council on Aging, for example. And through all this work and these partnerships, I think that we were quite successful in forming relationships to at least 60 out of the 85 councils on aging that were within our ACL grant catchment area. And as I mentioned, the work and the information we were sharing was of interest to the groups that were within our catchment area, that we did find many even outside of the ACL grant catchment area were interested in hearing what we had to say. I just wanted to highlight again in terms of the importance of screening, and then what we were hoping folks would do with the information with screening, because I didn't mention that, and I wanted to go back and just say another word about that. In terms of asking the public to help us to screen for a brain injury, we were looking to connect people with services. And so the older adults, oftentimes older adults in the community, whether they be connected already with the Executive Office of Elder Affairs in our state home care system, or whether they were individuals in the community that were maybe not connected with elder services. These individuals, we wanted to make sure that the community knew how to, again, ask the question, could it be a brain injury? And then what will they do, and what are the next steps? And so making sure that these entities were given the information about the services that existed in the state, but also the other way around, making sure that our networks, the brain injury networks, were understanding and educated about all that is offered through the aging service delivery system in Massachusetts. So if somebody was coming into the network or any of our networks from the opposite way, if we were working with somebody that was identifying as a brain injury survivor, could their treatment plan, could their experience be enhanced by having aging services included, and knowing about what programs exist for elder services as well. And we did that through doing some cross-training and making sure that staff at the Brain Injury Association were aware of elder services, and also folks from the Massachusetts Rehabilitation Commission, so that sort of we all understood each other's networks. I appreciate the time today, and I wanted to turn the presentation over now to Maggie Ferguson from Iowa, who's going to talk a little bit about initiatives in her state.
Thank you. Let's see. Super. There we go. So I'm Maggie Ferguson, and I am the Brain Injury and Disability Program Manager at the Iowa Department of Public Health. In Iowa, the Department of Public Health is the lead agency for brain injury in our state. As such, it's kind of positioned very nicely being in public health, because we have a lot of data that we're able to use to illustrate the real need behind falls prevention and outreach to folks with brain injury. So, like you've heard already throughout this presentation, falls are the #1 cause of brain injury in Iowa, as well as you've been hearing from other states and nationally. So the graph that you have on your screen is a pie graph that really illustrates just what that proportion is. So 66% of falls, of TBIs in Iowa are caused by falls, and followed then by motor vehicle accidents, an unknown category, and then also followed by assaults, and then those struck by or struck against injuries, which are usually associated with like sports injuries. So in Iowa, we also have a brain injury registry. Where we get our data from is from both the inpatient and outpatient data set, as well as the trauma registry. And we use that information to identify people who have had brain injuries in our state, to calculate out what some of the incidence rates are, as well as to do outreach. And so when we have that number, that information, we're able to let folks know of various resources that are available to them to support them post-injury. Also in Iowa, we look at what, within the Department of Public Health, what are the stats behind falls in our state. And so in Iowa, more than one older adult dies each day from a fall. That equates into a hospitalization cost per person of over $38,000. So not a insignificant amount. So we're actually seeing that amount grow. And in Iowa, our population is aging. So if we don't get ahead of trying to prevent falls within our state, this is just going to contribute to higher healthcare costs down the road. So as mentioned earlier by Chelsea, falls can have an impact on the individual by creating an increased fear of future falling. It can impact the mobility of the individual and their ability to perform activities of daily living, lead to social isolation and loss of quality of life. We also recognize that people who fall are at greater risk of falling again. Similarly, people who have had a brain injury are more likely to have a second injury. So just taking all of that into consideration has helped us to elevate falls and brain injury as public health issues within our state. Like many states, Iowa has a brain injury council. Our council is established in Iowa statute and is governor appointed. The membership consists of individuals that have brain injury, their family members, and a variety of professionals. It also has representation from various state agencies to contribute as part of the council. We also get regular participation from our managed care organization, our Brain Injury Alliance, and other folks who are interested in brain injury, such as post-acute rehab professionals. Our council also has state funds that they are able to use to carry out their work, and that's where our partnership really kind of kicked off. But before I get into that, I'm going to talk a little bit. On your screen, you'll see the covers from our state plans. The council reviews a lot of the data that we have from public health, as well as does annual needs assessments to determine what are some of the priorities within our state among people with brain injury and the professionals that are working with them. When they review that information, they hold also some public comment periods to gather additional information. And for the last several years, falls prevention has been recognized as a priority in their state plans. So this plan is not only just shared with stakeholders, but it's also provided to other state agencies, to our governor, and to our state legislators. This helps reinforce across the state that this is an issue that we need to pay a particular attention to. So in addition to the state plan, we also have out of the Department of Public Health, a community health needs assessment and state health improvement plan called Healthy Iowans. The Healthy Iowans document also contains a specific goal regarding the reduction of falls among older adults. The reason it's important to note this is that it's just an additional place where falls prevention has been identified as a priority area within our state. And the Healthy Iowans plan is a tool that public and private organizations are able to use across our state as a further reference when they are applying for grant funds or foundation funds or developing their own strategic plans for injury prevention in their area. So just continuing to spread the word about falls as being a top priority, both because of the data and because anecdotally it's important to people. So our council really took an interest in the falls, as I mentioned, and we're able to partner with the Falls Prevention Coalition that we have in our state to develop some increased awareness around falls prevention. It started off as I mentioned earlier, our council funds that they are able to use at their discretion for certain activities. When the Falls Coalition started, and still currently, they don't have any funds attached to them. They are not established as a nonprofit. It is solely a coalition of volunteers who have come from around the state to try and address the issue of falls. So the Brain Injury Council was able to provide that seed money to get a falls prevention symposium started, and then provide some additional support for each year that we've had that. That has been a great avenue for us to be able to provide education and awareness across our state. So that is an annual event that we have happening here. Organizations that participate have included folks from AAAs, hospitals, local public health, and others that are Brain Injury Alliance of Iowa. Another way that we've been able to work is our council has a prevention task force, and falls has been an issue that task force has decided to elevate. And on your screen, you'll see a picture of a storefront that is a regional grocer that we have in the Midwest that's headquartered here in Iowa called Hy-Vee. And our council went to Hy-Vee to ask if they would be willing to partner with us to distribute information across the state. They were willing to do that in conjunction with Falls Prevention Awareness Day. And so in the month of September, they had agreed to distribute falls prevention information through their pharmacy. So when an older adult came in to pick up a prescription, the pharmacist pulled them aside, did a medication review, and sent them off with some additional materials to look at. The council provided the funding to be able to create and print and dissemination. Those tools were also distributed through our community partners, through the Falls Coalition, the falls prevention leaders that we have in our state. And then we also made sure that we had endorsement from an initiative in our state called the Healthiest State Initiative. They are interested in increasing physical activity, improving nutrition, and addressing the obesity epidemic that we have. So by taking a really hands-on grassroots approach, our council has been able to really elevate the partnership of the coalition through their financial support and volunteer time. After we got that partnership really established and had some initiatives going in our state for falls prevention, then we were able to apply for and receive the ACL Falls Prevention Grant. So initially, Aging received that grant in 2014, and then in 2016 the Iowa Department of Public Health applied and received that funding. So we have a very strong partnership across those state agencies as well, so that we can further reach our respective audiences. So in Iowa, the first grant and subsequent grants have Matter of Balance, Stepping On, and Tai Chi for Arthritis as our evidence-based programs, which were mentioned earlier by Kelsey. We've been able to leverage the partnership with the brain injury staff from the Alliance and through the Council to provide technical assistance to falls prevention leaders and to make recommendations on strategies that they can be using to include people with disabilities, not just people with brain injury, but all disabilities, into their programs by ensuring that environments are accessible and their materials that they are using are accessible as well. One of the ways that we've done that is to take the forms that are being used and to produce them in large print. We also use those relationships to target our outreach. And so instead of just using the aging network, we're able to use the brain injury network as well to further get the word out about the classes, as well as getting the brain injury information out to the aging network just to further our coverage. So this screen just illustrates the various partnerships that we've had in our state. As I mentioned, we have the collaboration between the Departments on Aging and Public Health. We also partner with the Iowa Association of Area Agencies on Aging and the regional AAAs. We partnered with the YMCA of Greater Des Moines as a host for the evidence-based classes. We use the Falls Prevention Coalition and the Council on Brain Injuries, as I mentioned. The Brain Injury Alliance of Iowa has been a key partner. The Iowa Healthcare Collaborative has helped us to pilot some initiatives throughout the state in areas of high need. The Des Moines Fire Department has also been a unique partner in being able to distribute information, as their first responders are sometimes the folks that are able to identify individuals in the community that are frequent fallers because they're calling 911 to get that assistance. And so they're able to provide, some information to the individual about falls prevention and link them up with resources. And then, of course, the various leaders that we have across the state that are providing the evidence-based falls prevention. We also have the Iowa Brain Injury Network that we use to disseminate brain injury and other information as well. So as we've gone through the evolution of our partnership and then really solidifying and having some targeted activities through our grants, we've been able to expand the awareness activities that we have in our state. The networking, the activities that we've had have expanded upon the webinars and presentations that we have, both within the brain injury community to have falls prevention awareness as a topic, as well as within the falls prevention community around the brain injury. We do a lot of exhibiting at statewide and regional conferences to disseminate information about falls prevention and TBI. Falls Prevention Awareness Day is an annual event in our state, as I mentioned earlier. The picture that you have on the screen is a photo of an event that we had at our Capitol. We marketed it as the largest Tai Chi class in Iowa and encouraged other locations throughout the state to host Tai Chi demonstrations at that same day and time, so that we could collectively across the state be participating in Tai Chi at the same time. It was just kind of a fun event to be able to, again, generate more interest and awareness around falls prevention. That was also an opportunity for us to bring in a variety of vendors to exhibit and disseminate information. One of the partners that we reached out to was a running shop that sells shoes, and they had various shoes on display. We had an individual from an insurance company, and they had a display about falls prevention in the workplace. So really reaching out to a variety of folks in the community that are doing things around falls prevention as well, but maybe in a not your typical way that you would think of. So we also have created an online repository of the falls prevention classes through our lifelong links, which is maintained by our Department on Aging. And then the Iowa Department of Public Health has a webpage designated for falls prevention information and resources that are available and designed more for those leaders and other professionals in the community. So the lifelong links is more of the resource for the individuals, the older individuals looking for classes, and the IDPH page is more of a resource for the folks that are supporting those individuals. We also have had a more targeted effort on disseminating the STEADY Toolkit, the partnership I mentioned earlier with the Iowa Healthcare Collaborative. Is a mechanism that we've been able to do that, as well as through some of these other activities that are listed on this screen. So with that, I am going to go ahead and pass on to Susan.
Thank you, Maggie. Great. This is perfect. Okay, so I'm the cleanup hitter today, and my job is to give you a little overview of the state of the states with regard to TBI resources and programs. We say is no two people with brain injuries are alike. Really, no two states are alike with regard to services and resources that may be available and how they even began to organize their service delivery. So I'm going to give you a quick background and an overview of what those resources are to help you direct you to the agencies that may be involved in your state if you're not connected to them already, as well as some information about federal resources. Just as a quick history lesson, like many advocacy movements, ours certainly began with families and consumers that were looking to state government to fill a need in terms of providing some rehabilitative and long-term services and supports for individuals with brain injury and their families, because either their insurance companies did not pay for those kinds of services or they didn't have insurance, and they found that other state programs for people serving other population groups were not appropriate or they were not eligible for those services. So it really began in the 1980s, and it began with a woman from Massachusetts. Massachusetts is one of the states that was a leader in starting services in our country. And just as an overview, these are the areas that states did, and this is not in any particular order. But one of the things some states did, and Virginia was the first, was to establish a brain injury registry. It was often done in conjunction with spinal cord injury, so you'll find that states may have enacted legislation creating a head and spinal cord injury registry, and the purpose was to obtain some information around the numbers of people that incur a brain injury each year, that provided information to help with planning, not only in terms of the numbers, but the ages, the cause of the injury, and what happens to people generally after hospitalization, rehabilitation. This is data that your injury prevention use. Some states enacted their legislation to be able to gather names and connect people with services, and some states were able to do both through their legislation, but not all states have a registry as such. Another way states looked at addressing the needs was to actually develop some programs and services. A few states, Massachusetts is one, Missouri was another one, but there's a few other states were able to get a specific state appropriation, which was from general revenue, then that was targeted and appropriated specifically to address services and resources for people with brain injury and their families. Something that's unique in the brain injury field is the notion of trust fund programs. This is something that Pennsylvania was the first one to use this approach, where they actually designated a funding stream in order to produce revenue that could be used, and theirs was for a catastrophic fund, but that could be used then to address needs. And then, of course, states look to Medicaid to fund services and support specifically for people with brain injury who are Medicaid eligible, and then some states have a number of those funding streams that they pull together to make it work. And then advisory councils and boards. Sometimes states created advisory boards or councils first, and that resulted in legislation for registries. Some states, as they designed their programs and services, created an advisory council in order to help oversee the program and develop priorities and state plans, as Maggie talked about. This is how it looks now in terms of states that have what they call trust fund programs and state appropriations or state appropriations. As you can see, some states have not, such as North Dakota, a trust fund state appropriation only. North Dakota will and Alaska have it for service coordination or resource facilitation. Other states have trust funded programs only, and a few have both. Not all states can pass trust fund legislation. They find it's unconstitutional in their states, but many have looked at that as a way to fund what's needed. The trust fund programs are really unique across the country. They have a revenue generator. It's usually traffic fines, but some states will include boating while intoxicating fines. They'll add an add-on to those fines. One state added a surcharge to their driver's license, but they will define something where they can add a surcharge or fine. Then it's specifically to be used and collected and to be used for some aspect of brain injury. And that also varies. The purposes vary considerably. Some states use it even for research, public information, prevention. Some states use it to pay for service coordinators or care coordinator staff that are state staff, but a lot of states will contract out with associations or alliances that were talked about. Massachusetts talked about the Brain Injury Association, state association, and Maggie talked about the Brain Injury Alliance, which is also a parent consumer type organization. Others use other kinds of providers to carry out whatever is specified that the funds are supposed to be used for. And there's generally an advisory council or board that oversees that fund. The one thing that's unique about this trust fund is that they carry over with general revenue. That's usually done on an annual state fiscal year. With the trust fund, you can then, it's non-reverting. So people can accumulate that money across fiscal year so they don't have to start all over each year. So that's something that's unique about it. But it really varies across the country in terms of amount that's generated. We actually have 2 states that do not have a revenue generator. It's a voluntary. So it just really does vary. We also have a number of states who have home and community-based waiver programs. These are real similar to the programs set up for people with older adults, the elderly waiver programs. I have color coded this in that the blue states are the ones that are specifically for acquired brain injury or traumatic brain injury waivers, and they really do vary. They can be as few as 20 or serving over 1,000 people. The red states indicate states that did have brain injury waivers and have been rolled into their 1115 demonstration or managed care waiver programs. Missouri is pending approval, and actually Wisconsin should be buff color. It is a state that had a waiver and has since been terminated. Most of these programs have an age limit at 65, and once a person with brain injury is 65, they'll be then served by the aging or older adults waiver program. The agencies that are responsible for administering TBI services really do vary. Massachusetts, that you heard from earlier, their state program, which by the way has state funding, trust funding, and 3 Medicaid waiver programs, is administered by the Massachusetts Rehab Commission, which is where their voc rehab agency is. And then you just heard Maggie, who said her program is in the health department. But you're apt to find the TBI program in education or development disabilities or mental health or social services or Medicaid agencies. So it really is different across the country where the program is housed, and often that program will take on the culture of the agency that it's administering the program. And it's not unusual to find 2 state agencies involved in service delivery. So you may have a Medicaid waiver program for people with brain injuries administered by the Medicaid agency, while the trust funded, the state-funded program is administered by the health department of voc rehab. We have a federal law that's actually designed to help states with developing services or improving their service delivery or expanding services. It was first enacted in 1996 as the Traumatic Brain Injury Act of 1996, and it said it authorized funding to the Health Resources and Services Administration within the Department of Health and Human Services for state grants to help states either develop some of the components I talked about, like an advisory council, a state plan like Maggie talked about, needs and resources assessments, or states may have used and have used over the years to address unserved or underserved populations. And sometimes those populations are older adults, might be veterans, might be children and youth. It has been dependent partly on what the needs of the states are and partly on the direction that the federal agency wants to take. Another piece of that act, though, was to authorize programs to be carried out by Centers for Disease Control and Prevention through their National Injury Center. There is a TBI program with staff, and they do projects to obtain information on data and surveillance. Prevention is a piece of that, and those of you involved with the ACL Falls Prevention Program know that because they also coordinate with the Administration of Community Living around falls prevention, and they have concussion management, different programs, and they do public education. So they have quite a few things that they're authorized to do. In the state grant program, in that law does require advisory board. It followed what states had done in the 80s, how states organized service delivery in the 80s. Much of that is reflected in the federal law, and except that one of the requirements that the advisory board has to have is if there is a representative, if there is an injury control program, I'll say it right in a minute, if there is an injury control program within the state, a representative is supposed to be on the council. And the advisory board is really the planning body, the coordinating body to look at overall policy coordination among the agencies. And as I said, the use of funds has been pretty flexible throughout the years. It's been targeted for different areas that states have identified and the federal government has identified. In 2000, the law was reauthorized as part of the Children's Health Care Act. It expanded CDC's role, and it added a new component with protection advocacy services, and that's an independent agency. It's not a state agency, and it's one that can advocate on behalf of individuals with brain injury, and then also oftentimes they do class action lawsuits around service delivery. It was reauthorized again in 2008, and one of the changes in that law was to direct Centers for Disease Control and Prevention and the National Institute in Health to collaborate with the Department of Defense and Veterans Affairs to see how to determine the incidence and prevalence of military-related TBIs along with civilian TBIs, because most of your registry data that I talked about earlier, your hospital discharge data, your emergency room data, all those data capabilities that a state may have is basically capturing civilian injuries. So this was Congress's way to say we need to look at the whole picture of brain injury in this country. So if you roll it all together, how would we go about rolling all that together so we can get a bigger picture regardless of the cause? 2014, the bill was reauthorized. They removed HRSA, the Health Resources and Services Administration, from the state grant and protection advocacy grant programs so that the Secretary of Health and Human Services could decide where the best location of the program should be within the agency. It also directed the department to develop a federal interagency coordination plan to look at all the kinds of federal resources that may be available in a plan, and then it directed CDC to look at pediatric brain injury. And that's kind of been the trend with all these reauthorization laws. Whatever is of kind of particular interest or rising as a trend nationally, it often ends up as a provision within the law for CDC or NIH or somebody to undertake to further study and do research on. We are currently in the process of having our law reauthorized. Senate Bill 3657 actually passed the Senate last week, and the House version passed yesterday. This was done because Senator Orrin Hatch, who was a primary author in 1996 along with the late Senator Ted Kennedy, is retiring, and they thought this would be a nice retirement bill for him. And on the House side, Representative Tom Rooney, who has been co-chair of the Congressional Brain Injury Task Force, along with Congressman Bill Pascrell from New Jersey. Representative Tom Rooney is retiring, and they thought that would be good for him as well. We do have, and I didn't put it in here, but we do have a pretty active Congressional Brain Injury Task Force that does Awareness Day in March, takes on briefings. And we have actually done some briefings with the Select Committee on Aging over on the Senate side. So that is our group that we work with within Congress. It helps us to not only promote funding and advocate for funding along the TBI Act programs, but also to address some specific issues that may arise that we want further attention on. This bill, should it pass, and we think it will, what happened is the House passed its version, the Senate passed its version, but they're the same. So one of these bodies has to pass the other version. But this officially puts the Administration for Community Living as the agency to administer PNA grant programs. It also includes a new section that we're kind of pleased about and authorizes appropriations for Centers for Disease Control and Prevention to conduct a national concussion data collection and analysis. Much of the early data that was collected in the beginning, both at the state and federal level, were really capturing people that were hospitalized, that were more to moderate to severe injuries. This is a way to kind of figure out who or what's the incidence of people sustaining concussions that may not have been hospitalized, may not even had sought care from a physician's office. So this gives us a way to kind of capture a broader group of people with brain injuries. The program itself did move to the administration on Administration for Community Living in 2016. This is something we advocated for, the Brain Injury Association of America advocated for. We wanted to be housed there because we did know that there was Administration on Aging with the Falls Prevention Program, the Lifespan Respite Care Program, Assistive Technology, a number of programs that were there that we thought would be good to collaborate to make resources, to maximize resources and opportunities for people with brain injury to receive broader array of services. Our grant program happens to be an independent living administration. The PNA grants are in the Administration for Intellectual and Development Disabilities. These are have what they call state partnership grants. These were let like early June, late spring, early June. So everyone is just now on the first round, the first year of these grants. Massachusetts and Iowa both are grants there. They divided them up into mentor and partner grants, so they have a little bit different twist this year. And if I had all these maps to lay on top of each other that I gave you before, you will see some of these states have state or trust fund program, they have a waiver program, they have a grant program. And then you'll see other states that don't have any of these resources. So it really does vary across the country what's been made available. These are some of the topics that the partnership grants, the state partnership grant program are focusing on. Certainly to improve their advisory boards, targeting juvenile justice, looking at underserved populations, include older adults. Transition employment is just an array of kinds of areas that states may be putting their focus and their efforts and funding. There are a couple other programs that we work with that are focused on brain injury that's also in the Health and Human Services Department. One is the National Institute on Disability, Independent Living, and Rehabilitation Research, NIDLR, which used to be over in the Department of Education, and it transferred over with workforce, and I always want to say investment. That's not Investment Opportunities Act. I think I've got the wrong I in there. But that federal program, it transferred this program, Independent Living Centers and Assistive Technology, over into ACL. There are 16 TBI model systems that collect data. They do research. Some of the research they do happens to be around older adults with traumatic brain injury, also around chronic conditions as people age. What are some of the health conditions that may arise that may be associated with the brain injury? We also have one research and training center that focuses on community integration. And then there is the group, the MSKTC, the Model Systems Knowledge Transition Group, that collects information and fact sheets and has a website. So this material can be very useful to download if you want some one-pager or fact sheets on different aspects of brain injury, or if you want to see more about the research that these programs are conducting, it's on this website. And then, of course, within the National Institutes of Health, there's quite a bit of research going on with regard to brain research. For us in the brain injury community, most of that research is done in the National Institutes of Neurological Disorders and Strokes, which is also the lead agency doing the brain initiative. So those are federal resources that you can look into if you're wanting to know more about aging and people with brain injury. You will find some research materials there. So in closing, we have our website that you've seen at the bottom of the slides during my presentation, where we house state contacts. These change all the time, but if you run into problems, you're trying to find something in your state and you're finding you can't find them, you can always feel free to email us and we'll see to track them down. But we try to keep a list of the key contacts within the states for people to find. We also archive our webinars there, so in addition to this webinar, you can find other webinars that may be useful. And then it's already mentioned about our National State of the States meeting. This year it will be in Kansas City, September 23rd, 26th. And we do have Facebook and other social media places for you to go to find information. So that's the end of mine. And I am going now to hand it off to Carrie, who is going to then wind up their session. And thank you all for being on this webinar today.
Thank you very much, Susan, and thank you to all of our presenters. They were all fabulous. I think you all would agree that. We did not have any questions, as far as I know, submitted in the questions box or the chat box. We did have a comment submitted by Jeff Lauer of Iowa. He wanted the group to know that some states have alliances, as Susan mentioned, rather than brain injury associations, and you can find more information about those states by going to the usbia.org website. Thank you, Jeff, for submitting that comment. I'll also remind attendees that the PowerPoint slides from today's presentations, some of them are available in the handouts pane for download. The NCOA slides PowerPoints will be posted at the NASHIA.org website, along with the remainder of the presentations that are in your handouts pane. Everything will be posted there at a later date on the NASHIA website. If you do have questions and follow-up for our presenters, please email them to Haley Cushion at training@nashia.org, and she'll get the questions out to the presenters as appropriate. And we really thank you for viewing our webinar today. Please remember to complete your short evaluation following the close of the session. You'll also receive a follow-up email later today with the session's recording and a reminder about the certificate of participation that is available. And if you're interested in joining NASHIA, again, please contact Haley Cushion. She's our Member Services Coordinator, or Rebecca Wolf-Keel, our Executive Director. Thank you very much from NASHIA and NCOA.